Geez, right? Okay, there is a warning from the CDC today about a virus affecting children that could also lead to hepatitis. It is not coronavirus, but it is something called adenovirus. We are joined by Dr. Estella Alonso, Medical Director of the Siragusa Transplant Center at Lurie Children's Hospital. Good morning to you. Thank you for joining me.
Oh, good morning, and thank you for having me on.
Okay, first of all, explain to everybody what this is.
Well, the alert from the CDC is calling our attention to a series of cases in both the United Kingdom and in Alabama that occurred between the late fall and March of this year of children who had very severe hepatitis. Severe hepatitis is not common in childhood. Any big medical center might only see 5 cases per year. But in this setting, in one medical center in Alabama, they saw 9 children in this short period of time.
Wow.
And all 9 of those children were sequenced and found to have adenovirus. A word about adenovirus, it's a common virus that children pass among themselves. Usually is just a respiratory illness, sometimes associated with GI, vomiting, and diarrhea type symptoms. So adenovirus is not something that we usually think of as causing hepatitis at all.
Yeah, well, that's what I wanted to ask you. Well, 2 questions, but let's go with this first one. How in the world can something like that, respiratory, lead to hepatitis? What's the mechanism that gets you there?
Well, adenovirus is a type of virus that can cause injury to multiple organs in your body, but usually in healthy children, we only see a respiratory or mild GI illness. When adenovirus is an infection in newborns, we can sometimes see a severe hepatitis. When children who are on chemotherapy or are organ transplant recipients, when they get infected with adenovirus, they can have a severe hepatitis. What we don't understand is why healthy children in these little clusters developed a severe hepatitis, even though their immune systems should have been able to handle the virus quite adequately.
Okay, so we're talking respiratory at a time when everyone's dealing with COVID. What do you want parents to know? What are the symptoms? How can you tell maybe if it's the flu, the cold, COVID, adenovirus, and when do you know it's time to take action?
It's a very important question. That's the message we want to get out this morning, is that what you're looking for as a child, usually they're presenting with pretty severe GI symptoms, lots of vomiting, lots of diarrhea, to the point where you're concerned they're getting dehydrated. The next symptom that you might see is very dark urine, or certainly any yellowing of the whites of their eyes or their skin would be a tip-off that you need to seek medical attention. Your pediatricians are all receiving these same alerts from the CDC and are all connected into medical centers that are giving them this information so they know what to look for. And if you get their advice, they can take it from there.
Okay, so with that in mind, so you've given us what the symptoms are to look for. Let's talk about treatment for something like this. If this were to happen with your child, which, as you have said, is rare to see,
very rare,
what kind of treatment is involved?
Well, there is no specific treatment for viral infection with adenovirus in this type of setting, but what the child may need is supportive care with IV fluids and monitoring of their blood clotting and the functions of their liver. So many of these children were hospitalized, and that's what the CDC alert is really calling our attention to, is the severe hepatitis that requires hospitalization.
Okay, and while I have you, I want to take advantage of it because there's a lot of moms and parents watching this morning. And anything else that you want parents to know about any other viruses that are going around, or any concerns, anything they should be keeping their eyes out for?
Well, I think the most important message to understand is that viral illness in children who are, in settings where they're playing together and in school together is a normal part of childhood. And we haven't seen that very much over the last 2 years because of our intermittent precautions. And so we shouldn't become too alarmed if kids are bringing home a cold or a GI illness, but you need to use the same set of criteria that you used before the pandemic. Is the child really vomiting and not able to keep fluids down? Are we seeing symptoms that don't seem to be the common cold or the common stomach illness? That's a time to reach out to your pediatrician.
Okay, Dr. Estella Alonso from Lurie Children's Hospital. Thank you. Very important message. Good to talk to you this morning.
Thanks so much.
You take care.